Spine surgery is offering patients more precision, less invasion, and faster recovery times than ever before. This morning, we're taking a closer look at how this technology has really advanced in recent years. Joining us this morning, tell us more, is Dr. Peter Wagner, orthopedic spine surgeon and medical director of spine care at Wyndham Hospital. Dr. Wagner, thank you for being with us here in Good Morning Connecticut today. Can you explain how robotic spine surgery has really advanced in recent years and what makes it different from more traditional methods?
Sure. Thank you for having me. Robotic technology is really exciting in, various surgical fields, but especially in spine. So my grandfather was an orthopedic spine surgeon. He was doing robotic fusions, or sorry, rather traditional fusions in the 70s and 80s. It took a long time for people to recover. They had prolonged hospital stays. They went to rehab. Now we're doing things minimally invasively. People are going home the same day or the day after. So it's a really exciting field. It's really an exciting time.
Is it just because the robotic makes it so precise what you're doing?
Well, so the advantage of robotic technology is that it allows us to navigate screw trajectories. So what people require for placing, screws for spinal fusion is much smaller incisions. So, traditional open spine surgery required a much bigger soft tissue exposure. But nowadays we're able to do robotic technology through much smaller incisions. So that means a lot less soft tissue exposure, which for patients translates into much faster recoveries, and people are getting better faster than ever.
Yeah. Doctors, does this apply to all patients, or is anybody in particular considered to be a good or better candidate for robotic spine surgery?
Sure. So, generally speaking, people are good candidates for robotic spine surgery or people with neurologic compression and either instability of the spinal segments or a spinal deformity, so a scoliosis. Patients who come to see me typically are having back and leg pain. And if they have pathology that requires a fusion, robotic technology is a great way to deliver care in a very minimally invasive way.
What do patients out there need to know about the procedure itself, and what should they expect during the recovery process? You touched on it a little bit, but how long are we talking about, and is there any pain involved when you're actually in recovery mode?
Sure. I mean, with any surgical procedure, there's always post-operative pain, but nowadays, if we're able to do minimally invasive surgery, patients are requiring very little narcotic pain medication. There's sometimes we can do minimally invasive surgery where we just send patients home on oral pain medication over the counter. Basically, after you recover from the procedure itself, it takes a few weeks for the nerve symptoms to resolve and for the soft tissues to heal. But with robotic technology, people are getting back to normal activities like work and home life faster than ever. So,
That's incredible. And Doctor, finally, how is Hartford Healthcare utilizing robotic technology to improve outcomes for spine surgery patients?
yeah, so especially in the East region where I work, Wyndham Hospital, we've had a robot for probably longer than most other hospitals in the area. We've been catering to patients in the community. We have lectures coming up for people to explain sort of the process and what to expect and what kind of symptoms to watch out for and when to reach out for subspecialty care. Hartford Healthcare in general has really been a pioneer for this technology at multiple sites. So,
All right, Dr. Wagner, we appreciate it. Some
yeah, thank you.
pretty impressive innovations. We appreciate your time this
Thanks.
morning.